Hello and welcome. My name is Stephanie Malone. I'm a grad student here at Rowan University, and today we're going to be going through a critical review of the Cage Age screening tool. So the Cage Age screening tool is used by healthcare providers to help screen patients for the presence of an alcohol abuse disorder. Now, alcohol abuse disorder is a very common problem within the world, and it can negatively impact a patient's health, their relationships, public healthcare costs, and the safety of the community. And often it's characterized by persistent use of alcohol despite any, potential or actual harmful consequences. Now, the CAGE and the CAGE aid screening tool is an acronym that essentially stands for what the healthcare provider is screening the patient for. So C, the provider is going to ask the patient questions based on if they've been cutting down on any drinking or thought about cutting down on their drinking. A is about their annoyance or their perception of annoyance with others and concern about their drinking. G is about guilty feelings about drinking. Do they feel really guilty about how much alcohol they've been drinking? And then E focuses on an eye opener. So, is the patient using alcohol as an eye opener in the morning? Or ask them about any other eye opener instances in their life that may help them to, kind of start thinking about whether or not they've been taking in a lot of alcohol. Ideally, the healthcare provider should be screening every patient they interact with the Cage Aid tool. So just to kind of support, that statement, I just want to bring us to look at some data that was gathered in the 2011-2012 National Epidemiology Survey on alcohol and related conditions. So this survey was from a collective sample that was supposed to be pretty representative of the United States population, and it found that the prevalence of 12-month alcohol abuse disorder was reported at a rate of 13.9%. That's not including the prevalence of lifetime alcohol abuse disorder that was reported at a rate of 29.3%. So these numbers are quite staggering and show that, there are many patients that suffer from this disorder. Now, while providers should be screening every single patient, there are specific patients they should be paying special attention to. And these are patients with a family history of alcohol abuse, male patients, patients with other diagnosed mental health disorders, and patients in a low age range. So those typically meaning ages, 18 to 29. Now, for family history of alcohol abuse, there is an abundance of evidence that exists throughout research that really indicates that the presence of certain genes increases a person's risk of developing an alcohol abuse disorder. Now, two twin studies in the United States and Europe really suggested that about 45 to 65% of cases of alcohol abuse disorder are attributable to genes, to genetic factors. For male patients, gender is really a big predictor in alcohol abuse disorder. So for male patients, they often screen positive 3 times more frequently with the CAGE tool than women do. And that's because alcohol abuse disorder is much more prevalent in the male gender than with women. For mental health disorders, alcohol abuse is typically reported at a rate of 2 times higher in patients with mental health disorders when compared to the general population. And for age, alcohol misuse is reported at higher rates in patients between the ages of 18 to 29 than any other age category. Alcohol abuse disorder has a direct effect on the quality and quantity of a person's life, and that really stems from the fact that excessive alcohol intake is associated with poor physical health. Now, the World Health Organization, or the WHO, reports that alcohol is the third leading risk factor for disease and death. And they even found in 2012 that excessive alcohol consumption estimated, responsibility for about 3.3 million deaths worldwide. And a lot of that stems from the fact that alcohol abuse disorder is a risk factor for many medical conditions, including alcoholic cirrhosis, alcoholic pancreatitis, cancers of the upper gastrointestinal tract and liver, cardiovascular diseases, breast cancer, diabetes, and even fetal alcohol syndrome. And alcohol abuse is often associated with a higher risk of dying from liver cirrhosis by 14-fold, mental health disorder by 18-fold, cancer by 2-fold, and traumatic injury by 6-fold within 10 years of diagnosis. Excessive alcohol consumption is often a risk factor in development of oral cancer in 19% of cases and maxillofacial trauma in 72% of cases. And it's even associated with treatment noncompliance. So really all of these are a culmination of the fact that, you know, alcohol abuse really impacts the quality of a person's life because it directly is linked to poor health. Now, patients with both mental health disorders and alcohol abuse disorders often have higher rates of violence and suicide, longer and more frequent hospital stays, and even more social complications. And in the United States alone, alcohol abuse disorder is often associated with 3% of all deaths and 5% of premature mortality. Now, there's two main treatment modalities for alcohol abuse disorder, and it's really the healthcare provider determining with the patient whether they qualify more for an outpatient treatment therapy or if they require more inpatient treatment. So, outpatient treatment is driven by the primary care provider, and it includes oral medications such as gabapentin, folic acid, and thiamine that work in combination with outpatient therapies and support groups such as Alcoholics Anonymous. This type of treatment is most successful for patients with mild symptoms and those that have minimal risk of developing severe or complicated alcohol withdrawal. It's really important when patients, are in this route of treatment that healthcare providers are following up with them. And that's most important for the first 5 days after their last drink because that's when patients are most vulnerable to start experiencing more severe or complicated symptoms of withdrawal. Now, for inpatient treatment, this is more for patients that are going to have more severe or complicated withdrawal, or maybe they've tried outpatient therapy before and it just hasn't worked for them. So these patients are typically referred to inpatient programs where they're medically stabilized for about 3 days. So there's a bunch of programs that are available at the hospital I work at in Jefferson. There's New Vision. Patients come in through the admissions office, they're screened, and then they typically stay for about 3 days for medical withdrawal. Now, medications during inpatient treatment are typically a little bit stronger, and they're inpatient to have more assessment performed by healthcare providers. So typically benzodiazepines are the type of medication used in this case, and that medication can be very sedating, which is why they need to be in the hospital because these types of patients are going to require more frequent assessment of their respiratory status and their mental status. And this is especially important for patients that have alcohol abuse disorder in combination with liver disease because they're going to have a harder time metabolizing these medications, meaning that you may see more sedative effects in these patients. Now, effects of early treatment. Alcohol misuse is one of the most preventable causes of premature mortality, is illness and disability. Early identification and treatment of alcohol abuse disorder really helps to improve patient prognosis. So this really means when patients are coming into the primary care offices early on, maybe with signs of fatigue, is one of the biggest indicators of maybe an alcohol abuse disorder or another substance abuse disorder. Early identification of these problems and counseling from a healthcare provider is typically an effective treatment. When it comes to screening for alcohol abuse disorder, there's more than just the CAGE aid tool that the healthcare provider can use to help screen their patients. There's also alcohol use disorders identification test or the audit tool and the Michigan alcohol screening test or the MASS tool. So the audit tool consists of 10 questions and it really focuses on recent alcohol use and patterns of alcohol misuse. And while many studies have shown that this tool really has a higher reliability and validity than the CAGE aid screening tool, it's not really commonly used as it has a large number of questions that are associated with the screening tool. So it's harder for, primary care providers to implement this into their practice. And the same really goes for the MAST tool. So this screening tool consists of 24 questions when it's given in its unabbreviated version. There are two abbreviated versions that are available. So there's the 10-question brief MAST tool and the 13-question short MAST tool. But really, due to the length of the screening, it's not easily implemented into clinical practice. Now, when it comes to the cost of screening, given the fact that the Cage Aid tool is often a verbal assessment performed by the healthcare professional, there's really no direct cost associated with administration of the screening. So now moving into evidence-based practice, there's, many well-documented benefits of the Cage Aid screening tool. And it really stems from the fact that healthcare professionals really report having a difficult time tackling these types of discussions surrounding substance abuse with their patients. And, screening tools such as the Cage Aid kind of help to bridge these conversations with their patients and make it a lot easier. The Cage Aid questionnaire is typically the most widely used instrument by healthcare professionals to be to be used to help detect alcohol dependence and abuse in their patients. The National Institute for Health and Clinical Excellence, or the NICE, has published several guidelines validating the use of the KJ substance abuse screening tool in clinical practice, mostly because the literature supports the use of formal screening instruments over other clinical measures to increase the recognition of alcohol use disorders in primary care. The screening itself is brief, it's easy to use, the scoring is simple enough to be completed without a pen and pencil, and the use of the tool is really helpful in recognizing alcohol abuse disorder in patients who present in an asymptomatic manner. So the Cage Age screening tool can really help to identify patients who are at risk for development of health problems related to alcohol use, adverse drug and alcohol interactions, and even social problems such as relationships with families. Now, there are many advantages to using the Cage Age screening tool in clinical practice. And one of the biggest ones is that, with the stigma that's associated with alcohol abuse, a lot of times, healthcare providers may experience barriers with their patients giving honest answers to alcohol consumption. And this tool can really help to camouflage a lot of the stigma. Now, when it comes to reliability of the Cage Age screening tool, it really comes down to, determining whether or not the screening is consistent. And luckily, the Cage Age screening tool is often associated with a very high reliability or a very high consistency. And this is really especially true with patients that are suffering from other mental health disorders such as schizophrenia, anxiety, and depression. In general, there's been many studies that have shown that the KGH screening tool has scored as high as a zero point 0.8 to 0.95 in reliability screening results. And that's really stems from multiple articles, that looked at consistency in data when this tool was used. And even research conducted by Scogan et al. Found that the psychometric properties of the KGH screening tool are show an overall internal reliability of 0.68. So those are the questions associated in the tool. So when it comes to the validity of the KGH screening tool, we're really talking about the accuracy of the results that are retrieved from the screening. And the validity is really measured by both the sensitivity and specificity. So the KGH screening tool is really found to have a high validity with similar results spanning across several languages and patient populations. So this really includes patient populations such as inpatient psychiatric patients, ambulatory medical patients, and even inpatient medical surgical patients. And when it's compared to the audit screening tool, the KGH really performs with a higher validity, including superior sensitivity and specificity. One review of the KGH tool within a community sample of schizophrenic outpatients really helps to demonstrate how accurate this screening tool is when considering both the sensitivity and specificity. So in men, this study obtained at a sensitivity of 0.8 and a specificity of 1. 1 is the highest number you can get. In women, the study obtained a sensitivity of 0.6 0.63 and a specificity of 0.96. So in both of these populations, the specificity and sensitivity were both very high, which show that the screening tool really has a really great validity. So moving on to the use of the CAGE age screening tool in clinical practice, really the screening tool is one of the most frequently used screening tools for alcohol abuse or alcohol use in clinical practice, clinical studies, and even general population studies. And it really stems from the fact that it's very easily implemented into clinical practice as it's brief and highly sensitive to an alcohol dependence disorder. So it's often included within an outpatient primary care practices and inpatient practices. So for outpatient practices, it's often completed with new patient assessments and with each well visit and any sick visits that really warrant the provider to complete screening. So that's, patients that are coming in for fatigue or they're coming in for illnesses and, healthcare providers are noticing that they're coming in with symptoms of withdrawal or maybe they have bloodshot eyes and they smell of alcohol. Now, when it comes to inpatient, it's often completed by bedside nurses as a part of the admission assessment, and it can be, completed by the advanced healthcare provider on admission if patient has a history of alcohol abuse or family history of such. Now, providers are really promoted to ask their patients questions that follow the CAGE questionnaire. So if you look at the example to the right-hand side, that's actually an image of the CAGE age screening tool that's implemented within an inpatient clinical practice. So patients and providers basically go through the 4 questions that go with the acronym CAGE. So they'll typically ask patients, have you ever felt like you should cut down on your drinking or drug use? Have people ever felt annoyed or criticized you by your drinking? Have you ever felt bad or guilty about your drinking use? Have you ever had a drink the first thing in the morning to steady your nerves or get rid of a hangover? So these are simple yes/no questions. Providers will ask them. Each yes is scored as a 1, and any scores of 2 or higher to the CAGE questionnaire is typically considered clinically significant um, of alcohol abuse or dependence. Now, there's many considerations that the healthcare provider must make while administering this test, and we're going to specifically look at ethical, legal, and economic considerations. Now, for ethical considerations, it's really important that the healthcare provider administering the CAGE screening tool remains HIPAA compliant. So this really means that they're ensuring that the conversation occurs, maintaining the patient's privacy. And oftentimes, healthcare providers may get more honest answers from their patients if they, take this into consideration. When it comes to legal, the underage alcohol consumption is really an enormous public health care problem that carries its own set of legal issues. So really for healthcare providers, when they're screening, underage patients and they're coming back positive for an alcohol abuse disorder, they really have to start questioning, how is this patient obtaining alcohol? When it comes to an economic consideration, the costs that are associated with treatment programs alone are a huge consideration for healthcare providers to make because many inpatient and outpatient programs require patients to have insurance or a source of payment. And in addition to this, financial burdens occur for families, friends, and even the community when there's misuse of alcohol, mostly due to motor vehicle crashes, violence, and property crime. So in summation, the CAGE age screening tool is really a widely used tool by healthcare providers as it's brief and simplistic, yet highly reliable in identifying patients with alcohol misuse. Using this assessment really should be implemented in both inpatient and outpatient facilities to help identify patients at risk for alcohol abuse disorders and promote best patient outcomes. When patients are identified early with this assessment, healthcare providers can provide interventions that really, when they're implemented properly and early, can improve patient prognoses. I just want to thank everybody so much for their time and for listening to my presentation. Please feel free to reach out to me if you have any questions regarding this topic. I'd love to discuss with you. Below are a list of my references. There are 2 pages, so this is the first one, and this is the second page. Thank you again and have a great day.